I'm Jasmine Dustin. We're sitting here with Dr. Hubbard. We are in the new Playa Vista office, which is part of the Providence St. John's. Could you tell us a little bit about yourself?
Hi, I'm Stan Hubbard. Been a medical physician for a number of years in this community, and now I'm part of the Providence St. John's medical community.
So this is an amazing, beautiful, modern, wonderful new building. What made you guys choose Playa Vista?
Well, Santa Monica was the beginning of the St. John's venture. Santa Monica is a few miles away. This area is becoming more populated, and we thought it would be important to have an outreach facility in order to accommodate patients that are here for work and that live in the community. So it's a nice local facility for that purpose.
So tell us a little bit about the services that you guys provide here.
Well, we'll be starting off with adult primary care and pediatrics. Eventually we will be moving on to specialty services, which will include cardiology, GI, OBGYN, things of that nature.
And you also mentioned primary care. Why is it so important for someone to have that?
Well, primary care is the edge of the sword into medicine. As a primary care physician, our first job is to take care of the patient. You know, we take care of medical problems as well as other doctor specialties. But it's also to be able to matriculate the system, to figure out how to get to the next step. You come to the primary care doctor, and we discuss your symptoms and your problems, and then we decide whether we can take care of it here or whether you need a specialist to help us navigate your medical problems.
And what would your style be?
My style is more, the patients are more of my teammates more than me dictating and delegating what their issues are or what their symptoms or problems are. You know, I encourage patients to go and look at different websites that are appropriate to have some information to talk to the doctors with, so we can discuss their issues, and so they have an education about, you know, what their expectations are and what, you know, our next steps would be.
So you had said that having a primary physician is very important. What would you say people should look for in finding one?
They should look for someone who reflects their values, someone who is personable, someone who they can relate to, someone that they can talk to and feel comfortable making decisions. Picking a doctor is important. I think that you should make a get to know your doctor appointment so you can have this discussion not necessarily when you're sick, but when the person comes in, just to make that decision on whether you can relate to the doctor or whether the doctor can relate to you. So it's a two-way street, and again, that becomes part of the teammate situation that we talked about.
So here at the Playa Vista, it's filled with lots of millennials, which we know do not have usually a primary physician. Why would we suggest that it's important for them to have one?
Well, first answer is preventive medicine. So you want to be able to find things in people before they get sick, decrease their fear of coming to the doctor. Most guys especially don't come to the doctor unless there's a problem. So that's why men tend to have more medical problems than women as time goes on, because women come in for preventative services, pap smears, pelvic exams, mammograms, breast exams. Guys don't really have anything like that. So in order to have those problems diagnosed early, you would come in on a regular basis, whatever age it is that makes that appropriate for you. Every year, flu shots are appropriate, so coming in once a year for a flu shot is appropriate. The age is also the determination of when you come in for certain tests.
So if I needed a specialist, would you be able to refer me to someone? How does that work?
We would first discuss your medical problem, and we would decide whether we could take care of it in our office or not. And if we decided it was appropriate together, then we would send you to the appropriate specialist. The specialists are all part of the St. John's network. They're local, and you would be sent to them based on your medical problems, and then they would go forward and take care of the issues as well. To continue with the team approach, you and I are teammates, the specialists and I are teammates. We all discuss the issues. They will get back with me, either a phone call, which they tend to do, or they will email me, or they will send documentation through my chart to let us all know what's going on with your medical issues.
So millennials, they don't have a whole lot of time on their hands. So how would you suggest they maximize their first appointment?
I would suggest that a patient come in with a list of concerns and questions, with the most important concern first, and then 2, 3, 4, and 5 can be least important, in order that we address your concerns and that your expectation of the visit is fulfilled.
So what makes Providence St. John's at this beautiful location different than other facilities in the area?
Well, one thing, we're not a teaching hospital.
Okay.
So the doctors who are going to be taking care of you are the actual people who are on the case. They're the experts in the field, and you'll be seeing who's taking care of you. The second part of the equation is that the doctors are usually living and working in the same community, so they will know their patients not only in a medical standpoint, but they'll probably see them at Costco or at Ralph's or somewhere. And so it's more of a community-based situation than a university setting.
Right, okay. So thank you, Dr. Hubbard, for sitting down, answering my questions. I think the community is going to be ecstatic over this new building and Playa Vista. Anything else you want to add or share?
Thank you very much for the interview, and I'll see you guys soon.